Get ready for a no BS approach to health and fitness. This is NBS Fitness Radio.
What's up? We're back on NBS Fitness Radio. I am here with Jason McOlgan. He works for Ageless Men's Health. It is a testosterone replacement clinic, a men's health clinic, and he's gonna give us the lowdown on men's health, especially with regards to testosterone. So, say hello, Jason.
Hello.
Awesome.
Thank you, David, for having me today.
Absolutely, bud. All right, let's just start off with an easy question. What is testosterone and why do we need it?
Testosterone is the primary hormone that drives men. Gives us our energy, muscle content. It helps us sleep at night, keeps us interested in our wives, but it's what primarily makes us men.
Gotcha. What causes it to decrease in men, and when does that usually happen?
A lot of things cause it to decrease. Modern living is kind of the overarching thing. Stress.
Okay.
Not sleeping at night. The constant contact we have, which is great for business. Well, for stress, it's terrible because we never disconnect.
Gotcha.
So what we see is a lot of men in their 30s now, a lot more are showing up with low testosterone. And in fact, if I have a guy that's 55 and his son comes in and he's 25, 9 times out of 10, the 25-year-old be lower than the 55-year-old.
So why is that? Because, I mean, I feel like the 55-year-olds probably experiencing similar levels of stress, or is that not the case?
It is the case.
Okay.
I don't know if it's adaptation. I think that the older generation, I'm 48, so, I grew up, we weren't eating fast food all the time.
Yeah.
It was eating at home mostly, and you occasionally went out to eat. Fast forward to today, and going out to eat is kind of a way of life. You look at all the restaurants, there's just, there's a whole lot more of that. With that, you're not eating as healthy.
Gotcha.
They're worried about, does it taste good, or are you going to come back?
Right.
Not, is it good for you?
Right. Yeah. The boiled chicken breast isn't exactly a line maker.
No. Boiled chicken and broccoli that has no seasoning like that. That's not a big seller.
Yeah, I've seen the data about like how just the overall decrease in testosterone from generation to generation, not even on an individual basis, but just like generationally from men, and how dramatic it's been basically in 3 generations, from our grandparents who were born in the late 1800s, early 1900s, to our parents who were born in the 40s, 50s, and then our generation. It's been like a drop off a daggum cliff.
Yeah. So if you go back to the 40s and 50s, they had studied men, and they were looking at 60 and 70-year-olds, and their testosterone was running around 700.
Dang.
So the other problem we have is many of us have jobs that we're not physically active.
Yeah.
Then you don't sleep all that well at night because your brain's really tired, but your body's not. So after 2 hours, you wake up.
Yeah.
And you're not rested.
Yeah.
But your brain's kind of caught up.
Yeah.
And your body then is not ever catching up. And then you make it at night while you sleep. So if you get into a cycle of not sleeping well, you stop making it.
Yeah. So basically that combination of, so you could almost say like that, men were designed to do physical labor, to eat quality food, to get quality rest time, including sleep. And when you're doing that, your body functions the way it's designed to function.
I think that's well said.
But when you knock that off track, either by not exercising regularly, by putting poor fuel in your body, or by overstressing yourself and not allowing yourself periods of to recover from that stress, you basically are just filling your cup with stress and never allowing it to be released or relieved. And so your body isn't going through this natural processes like it's supposed to, and then replenishing and building your testosterone back up. And then years of that, and your body just kind of adapts to not making testosterone.
Yeah. And then you have the added problem of when you take out. So this is all in a system that's working together. If you take out one piece, the system starts to break down. And so if you're not sleeping, that part breaks down. If you're not eating well, if you're not getting the exercise. So if you don't do any of those things, it goes much faster.
Right.
And we see that with diabetes and overweight and, highly stressed, heart attacks at young ages. We see some people like that. But yeah, it's that combination is really bad. But if you just take out one piece of a puzzle, all of a sudden the puzzle doesn't work.
Yeah. So you almost say like testosterone levels could be an indication of like your overall health.
Absolutely.
To a degree.
Yeah.
So basically, as guys, our modern day life is kind of messing with their testosterone. What are the effects? How would you know that you had low testosterone without getting it checked? What are some kind of effects of that you could be aware of?
So things that you would notice pretty quick are you're not sleeping as well, waking up feeling like you haven't rested. Even if you had 8 or 10 hours that you were in bed, but you wake up not feeling rested, that would be an indication that something else is going on. Not able to put muscle mass anymore. You work out, you don't recover. You're 5 days post-workout and you're still sore. Or even 3 days, because you should work out, recover the next day, and then by that third day, second or third day, you're able to work that muscle group again.
Right.
You may not, depending on your workout program, but it's not so sore that you can't work out. So that's a big indicator. Lack of interest in sex or a decrease. And one of the questions I ask my guys when they come in is, have you had a decrease in sex drive? And a lot of times, oh, no, everything's great. Okay, if they're in their 30s, are there times when you turn down sex and you choose sleep over sex? And often the answer is yes. And then I take them back. When you were 25, did you ever turn down sex for sleep? Well, no. So there is a decrease. So it can be insidious because for us, for men, it's a slow, steady decline most of the time. So it's it kind of creeps up on us, and we think we're still good, and things have changed.
Right. So if you're kind of living the traditional American life, which is consistent of basically treating your body like it's unimportant and only pushing it to the limits with regards to work or social media,
right?
And then you start feeling this, like, man, just like I'm feeling kind of worn down. I'm kind of dragging out. I don't really have like the same energy I used to. Like, I don't really want to work out, and even when I do work out, it kicks my ass, and like I can't recover from it, and I don't really have this. I don't feel like I did when I was 18 in my 20s. Like, my wife and I still have sex, but I'm not really like gung ho. It's just kind of like, oh yeah, we gotta have some sex today.
Yeah. But another thing that we'll see is guys will come in and their wives are convinced that they're having extramarital.
Yeah.
Because they're not interested.
Like, I'm not interested.
There's no pursuit. They've pursued their wife their entire marriage, and now all of a sudden there's no pursuit. And so the wife thinks, what are you doing? You must be going somewhere else because we're not doing anything.
Yeah.
And so we've had really good success of essentially saving marriages because we get these guys back to normal.
Yeah.
And then all of a sudden things are back to good, and
that's I never thought of it like that, but that's kind of a crazy way, a crazy realization that, like, man, my wife thought I was having an extramarital affair just because my testosterone level was so low that I wasn't interested in her anymore.
Yeah, just the loss of interest is for many women. We won't say all, but for many women, that's what they believe.
Right.
And yeah, because it's a big change.
Right.
I think.
One thing I was thinking about the other day was, I feel like in your 30s, it is kind of like a pivotal moment, especially in men's lives, because you've got like a family you've probably got a family coming around. You're probably getting a little bit more established in your career. And You've also got a little bit of life experience now. Now you kind of like understand a little bit more about life, finances, family dynamics, all this kind of stuff. And I kind of see one of two things happen a lot in guys in their 30s. One is complacency. They just kind of fall into the rhythm. I fall into the rhythm of my day-to-day life and kind of focus on my job and pursuing my career, and I'm just trying to kind of get by day to day. And if that takes hold, that complacency takes hold, but they're just kind of like okay with who they are and what they're doing and just kind of fall into that like rhythm, it's bad because it becomes deeper and deeper ingrained in their 40s, 50s, and 60s and 70s, and the likelihood that you're going to change your outlook on life or your pursuit in life at your 60s after you've been doing it for 30 years is like zero. Yeah. The flip side of that is in your 30s, kind of coming through and getting a little bit more life underneath your belt, then you kind of have the desire for like self-improvement. How can I become the best version of myself?
Yeah.
How can I make sure that I'm not only pursuing my career, but I'm pursuing purpose? I'm not just trying to make money, but I'm trying to steward it to the best of my ability. I'm not just trying to have a family, but I'm trying to raise and create an amazing family, be the best dad, be the best husband, be the best version of myself. If that takes hold in your 30s and you get 30 years underneath your belt, then when you're at your 60s, you're such a benefit to society and the people underneath you, because now you have like some true wisdom underneath your belt that you can really pour down into other people. And for so many dudes in their 30s, because they haven't taken care of themselves and their testosterone's low, they don't have the energy. The idea of like exercising, eating good, reading at night, doing anything but sitting on their ass watching football and drinking beer as their pastime seems like undoable.
Yeah.
And it's sad because if you let that take hold in your 30s, you're in deep shit when you turn 60.
Well, and I think you hit the nail on the head. That in the 30s, we've got young kids, we've got new careers that we're in, we've got, maybe a wife. There's a lot going on, and it's a busy season.
Yep.
And if we let busyness just take hold, you sit around anytime you can because you just don't have any downtime.
Yeah.
So if you've got an hour to watch TV, you're going to take advantage of it rather than going and working out.
Yeah.
And it's a bad cycle to get on because it promotes more unhealthy living.
Yeah.
It gets you further down that road of now I'm even heavier than I was, and I'm further away from my fitness goals, which usually takes you away from your personal goals in your business, in your family life. You don't want to go throw the football with a kid because my shoulder hurts. I'm tired.
Yeah.
Every time I do something with you, I hurt something because I'm so out of shape that my tendons and ligaments are so tight. I can't go run in the front yard with you.
The only thing I'm good at is sitting down.
Yep. Yeah. Yeah. And it really is a tough cycle to get in. And it's something where, 30's not too old, 40's not too old, really 60's not too old.
Not too old. It's just those habits become deeper ingrained and harder to break.
They do. They do. But what we've seen is with, testosterone doesn't fix everything, but it is a really good aid.
Gives you a jolt.
Yeah.
It gives you a kick in the ass. It says, I got some more energy to do some stuff.
And when you do those things, you get results.
Yeah.
Whereas if your testosterone's low, I go and I work out and it feels like somebody beat me up.
Right.
When it's optimized, I go and I work out and I feel better.
Right.
I get a pump.
Yeah.
I feel like, I want to do that again. That I get that endorphin kick.
Yeah. Each positive change you make has a positive effect, which is just momentum and inertia and fuel to I'm gonna keep making these positive changes.
Yep.
Yeah. Okay, so you're kind of doing all this stuff, and you may be thinking to yourself, man, you guys are talking to me, right? And you decide to go into the testosterone clinic and you get your blood work checked. What are kind of the levels that would be considered healthy, the healthy range for testosterone?
So what we're shooting for is to have our guys running 700 on their testosterone and their estrogen running around 30.
Okay.
If we've got you there or close to there, usually things are going well. Now, we are a clinic, too, that individualizes treatment. So we look at the person. Some guys feel better at 500.
Yeah.
Some guys feel better a little higher. So we look at the individual and see what are they doing and what is their health and how can we make them their best version.
What would be a level that would make you go, okay, yeah, your levels are definitely too low? Like, what's kind of like the bottom? Like, if I went there, I was like 450. I feel like crap, though. Mm-hmm. Like, what are kind of those levels you're looking at?
So 400 and lower is kind of automatic. Like we should treat you.
Yeah.
If you're in that 400 to 500 range, there's a little bit more. We do a little more investigating to see what's going on, both with like getting your medical history and seeing where are you, but if needed, getting a little bit more lab work to see, do you have something else going on?
Is there effective treatment that doesn't involve testosterone replacement? Let's say I decide I'm going to start exercising, eating right, I'm going to turn my phone off at night. Or does that ever have like a positive impact?
Possibly.
Yeah.
To be fair, I'm at a testosterone clinic.
Yeah.
So the people, and not even just that I'm promoting it, but the people that I see that I have contact with did not. They've tried a lot of those things, and it usually does not work.
Yeah.
But if it worked, they wouldn't come see me.
Right.
So that's the part where I say, to be fair, like I can't make that determination.
I didn't know if there had been any studies or not done.
I have not seen anything like that. But the big problem is, if you disconnected from society, basically, turn off your email, turn off your phone, don't turn on the TV, don't watch the news. And now what are you eating? I'm eating chicken that I grew with vegetables that I grew.
Right.
And that's what I tell guys. If you're ready to get off the grid and go live in the wilderness, maybe you can do it.
Yeah, but your skill set as an accountant
doesn't
transfer
to
over
well.
to like farming.
Right.
I've had guys that have come in here and like started training, and done all the stuff and not seen the results that they've wanted to, and we've kind of come like, okay, remember at the beginning when we said you should probably get your testosterone checked? Now it's time to actually go get it checked. And even after like long periods of time, 6 months, a year, it's not in an appreciable level.
Right.
It may not be like, bottom of the barrel terrible, but it's not. It's almost always resulted. The only thing I've seen, one person who was in their 20s got on a Clomid regimen and was able to bring it back up.
Yeah, but Clomid is doing similar things to testosterone.
Yeah. It's still
it's getting your body to make it. And the thing that I've seen not very many times is if a guy is younger, like you're talking about, and he's morbidly overweight.
Yeah.
If he's 400 pounds and he can lose 200 pounds and be a 200-pound man at 5'8",
yeah,
his chances of having improved natural testosterone go way up.
Yeah.
That's just not where the majority of people live. Right. They're usually 20 to 50 pounds overweight. They've had a lifetime of abusing their body. Maybe they've done steroids on their own, but they've done things to impact their endocrine system that makes it where their body doesn't work like it's supposed to. And so this is much like treatment for diabetes.
Yeah.
Diabetes, we don't have a fix for it, but we can treat it and keep you healthy.
Yeah.
Testosterone's like that. When the system stops working, we don't have something to just fix the system again and turn it back on, but we can treat that and get you much healthier than you currently are.
Yeah. Well, yeah, I'm thinking in 10 years, I'm probably 500 people a year, so 5,000 or so. I've seen one person it worked on.
Right.
So like that's my data. It worked on one dude out of 5,000.
Right. And in the Memphis area, I think we've screened somewhere around 30,000 people.
Yeah. So yeah.
So we've got a lot of data, not a lot of people. I can think of one guy that we were treating for a while. He got off of treatment, did some big life changes, and came back in a year later and said, "Hey, will you test my levels again?" Yeah. And he did. He normalized. And you go, I hadn't seen that before.
Wow. Yeah.
But it's one guy. So it's not impossible as well. And I'll tell people that when they come in.
Yeah.
It's not impossible, but it's not likely.
Not likely either. Let's you kind of mentioned like steroid usage a little bit. So I think I've had people, they made a comment that they were on testosterone therapy and they're like, "Well, I don't do steroids." So I kind of giggled. I was like, that's a steroid, but
it is an anabolic steroid.
Yeah. And so talk a little bit about how using anabolic steroids, testosterone is an anabolic steroid, but talk about how using that would impact your body's own natural production of testosterone.
So your body's making testosterone. It's called the negative feedback loop. So your pituitary is basically looking at how much do you have? How much testosterone does your body have? And if it's got enough, then it doesn't send the signal to make more. So if you're taking something in from outside, it stops sending the signal, and your testicles are the ones that produce it. So after a time, if you continue to not send that signal to do work, just like putting your arm in a cast, when you get your arm out of the cast, the muscles have atrophied. The same thing happens to testicles. They will atrophy and they will shrink. And at some point they can become ineffective completely. When does that happen? That's very much a individual thing. So we don't know, but continued use will shut down the system. We've seen that reliably.
Yeah. And that's basically what happened to me. I started taking testosterone early in my 20s for competitive powerlifting purposes. And then when it was time to have some babies, guess what? I couldn't make babies.
Yeah, the boys were not ready to work.
They were not ready to work. So I had to come off of everything. And I remember like 4 weeks after taking my last shot, how like it felt like someone stole my mojo. Like, dude, I felt like someone kicked me in the face. I was like instantly like, ooh, I don't feel good today. Yeah. And I just never got even bit better. I just no energy, no sex drive, felt depressed and kind of just ugh. And when I got my levels checked, and I was like 148, I think, something like that. So pretty daggum low. Pretty low.
Pretty low. One of the things too we do is we do something called HCG. It's human chorionic gonadotropin. But what it does is it keeps a guy producing testosterone while he's on testosterone.
Yeah.
So while illicit use of steroids definitely can break down your system, if you're using it clinically and doing it properly, we have ways to keep your body doing what it needs to do. Because we've actually had guys while on treatment get their wives pregnant.
Yeah.
Probably get other people pregnant too. But they've told us about their wives. But the HCG just keeps you producing and keeps it functioning. Because like you said, when you get off of it, when your levels are low, if you're not having sex, you're not going to have a baby.
Yeah.
It doesn't work like that.
Right.
So you need both the sperm count to come up and the testicles to work, but you also need everything else to work so that you can create. Yeah,
and that's basically what happened to me. Had to get on that and some Clomid, and eventually had some babies. Mm-hmm. But my test levels never came back up. I mean, on my body, I think I was just on for so long that, they never – I think I did Clomid for a year, HCG for a year. And, like, after that, I got my levels checked, and I was, like, 184.
Right.
It wasn't like right. But I made sperm and ended up having 3 kids.
Yep.
But I was never able to get my natural levels back up. So, speaking from experience here, if you're in your 20s and thinking about starting to take anabolics at an early age. Very much consider the consequences that's going to have later in your life when you might want to have some babies. Because like now that I have 3 kids, like the thought of doing anything that would have like kept me from doing that is like haunts me. I'm like, oh my gosh, what if I wasn't able to have like the greatest gift I could ever ask for is my kids?
Right.
That would be very sad to me.
Yeah.
Um,
One of the tough things of being guys, though, is when we're in our 20s, there's not a lot of forethought.
Nope.
There's not a lot of foresight. You know, we're living right now.
Yep.
How do I get through today? How much fun am I going to have?
1,000%. What's the most weight I can lift, and how do I do that? What's the lowest testosterone level you've seen?
0.
0 on a dude?
Yep.
Oh my gosh.
Yeah.
Visibly, could you tell?
I mean, it looks and feels like somebody that's at 150, quite honestly.
Yeah, okay.
His symptoms were the same.
Yeah.
Like before I drew his blood, if you'd have said, what do you guess he's at? 150, 200.
Yeah, something low.
Something low, but yeah.
Yeah.
And then he came back at 0. And
That's crazy.
Yeah. But just not making any.
Man.
But, you know, week after week, his levels came up. He started feeling better. He was pretty excited about that.
Yeah. I was off of testosterone for 4 years. Now, I mean, I own a gym and I'm obviously into fitness, so I kept training, kept eating right, kept sleeping, going to sleep on time. And I eventually got to back to the point where I was like, I feel more normal. I could tell. I was like, I just like hard workouts would kill me. And I just mentally just deal with it and come back in the next day and work out. I couldn't put muscle on near like I couldn't, and I would lose muscle really easy. If I
Really fast.
If I drop my calories, I'm like, shit. I dropped 100 calories and I lost 3 pounds of muscle. Like, what the hell?
Right.
So
right. The fat won't come off, but the muscle flies off.
Yeah, I couldn't get fat to come off, and I could lose muscle like it was nothing. And I think my sex drive like evened out a bit, but it never was like back like it was or supposed to be. And so, but like finally got back on after we like had our last kid. I was like, oh yeah, okay. I remember this.
You can breathe.
This is what it's supposed to feel like.
Yeah.
I feel like a dude again. I feel great.
Well, you know, other things it does is like depression.
Yeah.
Depression is prevalent in people with low testosterone, anxiety.
Yeah.
Which, when you think about it, it makes sense. At 18 to 25 years old, there are people that have anxiety, but the majority of young men that are healthy, they're not dealing with depression and anxiety. They're thinking about what can I do that's super fun.
Yeah, you're filled with vigor and
yes,
youth.
Yes.
Yeah.
And so getting your testosterone levels back, your anxiety levels go down dramatically. You're not concerned about all the what ifs. And it's so one of the things I relate to people is I travel some with my work, and I had gotten to where flying would give me a great deal of anxiety. Yeah. And after I've been on testosterone for 10 and a half years.
Yeah.
And flights these days, last, 8-10 years, it's nothing.
No big deal.
Get on plane, go fly, get where you're going, go do what you're doing.
Yeah, I think one of the things, sometimes people will be like, oh, when you get testosterone, it makes you like aggressive. I think that's kind of a bad way of viewing it. If you're an asshole, you're going to be an asshole no matter what medication we put you on.
Right.
But it takes, what I feel is it makes, and I've never really had anxiety, though I felt more anxious, especially in the transition. And I don't want to say I ever got like depressed where I had like clinical depression, but I felt more sluggish, less in a good mood, and just kind of in the dumps a lot.
What we see is less drive for life, period.
Yeah.
I'll have guys that they've got a classic car that they love and they've worked on for 20 years, and they come in and it's been sitting for 5 years. Haven't touched it. Don't have the energy to get out in the garage. Don't want to crawl around. It'll be that. It'll be whatever hobby it is that they're into. Golf. They don't want to go out and golf anymore. Yeah. They've got friends that do it, but I don't want to.
Yeah.
And oftentimes what we see is their testosterone's low. We get that fixed. They're right back to living their life again. And that's really what we're going for, is to get you back to being you.
Yeah.
We're not looking to make you into Arnold Schwarzenegger.
Right.
We're not looking to get guys jacked. We're looking to get them back to healthy.
Yeah.
And the guys that can put on muscle, they do. They put on muscle. The guys that are, never had any muscle, they may be able to get some muscle and get lean, lose some body fat, but it doesn't transform you into a new thing.
Yeah. Yeah. I would say the effects I feel, is it gives me a vigor for life, and it gives me drive, and it makes me more appreciative of the things that I appreciate, and more passionate about the things I'm passionate about. Mm-hmm. And it's kind of like with supplements. A lot of times people are like, what supplements should I take? I was like, well, understand that the word supplement means it is a supplement to a great diet,
not a replacement,
and a great training method. So you can take testosterone all day, even if you're not training and eating right appropriately. Like, you're not going to turn into a performance machine. Yeah. You have to apply all those things together.
Yeah, and this is testosterone is it's a participatory kind of event.
Yeah.
If you're eating right and you're exercising while you're getting your hormones optimized, the world is your oyster. Go and be merry.
Yeah.
If you are just taking testosterone and hoping that somehow you're going to turn into a CrossFit champion, it's not happening.
No. Those guys, well, I won't go down that road. It's and it's, I like the word you said, participatory, meaning if you're, it's not going to help you skate by and not still give it your all. But if you're already giving it your all, man, it's just a shot of nitro that gives you even better results.
It is. I have come to realize it's much like your food intake. So testosterone lasts in your body. When we're doing injectables, it's got a 7-day half-life. It peaks in 3 days. So we do weekly injections, keep people on a good even keel. But if you're doing a whole lot, you need more medicine.
Mm-hmm.
You need a higher milligram dose each time. If you're doing less, you need less medicine, much like caloric intake.
Yeah.
If you've got a guy that comes into your gym that's killing it all the time and he's not increasing his calories, at some point his body starts eating muscle.
Yeah.
And so you got to encourage him. Like, no, you need to, let's get you good, clean calories, but you need to increase your calorie intake.
Yeah.
You may need 3,000 or 3,500 calories a day if you're going to keep these workouts going.
Yeah.
And we do that. And I encourage my patients to do the same. If you're working out, keep working out. Tell us what you're doing.
Yeah.
Let us retest your blood, and we'll keep up. We can keep up with what you need. You just have to participate. You have to let us know what's going on, and there's a whole lot we can do.
Okay. What about testosterone in women? I mean, obviously you guys are a ageless men's, but what about testosterone in women? Does it play a role? Do you see any necessity for testosterone replacement in women?
Yes, great question. We do actually treat women as well, even though we're ageless men's health. We do women's testosterone. And the way we do it is we have a B12 shot with a lipotropic shot that and the testosterone.
Okay.
With them, we also do typically a weekly regimen. It's a really small dose. It's about 1/10 of the dose that a man would get. But what we find is it does the same things for them. They sleep better. They lose body fat, gain muscle, mental clarity. That's one of the things I didn't hit on earlier. Less anxiety, less depression. It kind of opens things up for them. They're more interested in sex.
Yeah.
It's
same effects.
Same effect.
Just different magnitude.
Yes.
Yeah, they're about 1/10 of what you would see in a guy.
And that's typically where we want to run their levels as well. We want to, if
we're 50 to 70. Yeah.
If we've got them in that range, they feel good. They're not having any issues of hair growth on the face or deepening of the voice or any of those sorts of things.
Yeah.
And they just work better.
Yeah.
They function at a more optimized level. And so, yeah, we have quite a few women that are on treatment, and they're having similar success to what our men do.
Very cool. Okay. What about what happens if your testosterone levels are too high? What happens if you're going in, like, how would you might feel that, or what would be the side effects of having too high levels of testosterone? Maybe your dose is too much or something.
Yeah, if your dose is too much, well, one of the big things we'll do is blood testing.
Yeah.
But if it's symptomatically, if you're coming in and you're telling me, I fall asleep easy, but after 3 or 4 hours, I wake up and I'm ready to go. Like, I feel like I could go run. Probably too high. And so then some of the other things we'll see is that it can have similar effects to low testosterone.
Okay.
You get to where you feel fatigued.
Yeah.
And your brain gets foggy, but a lot of times that's because you're not sleeping well.
Yeah.
And so when you get to where you can't sleep, all the low testosterone, even though your testosterone levels are good, all those symptoms kind of show back up because your brain's foggy and your body's tired because you're not getting rest. But yeah, and then other things that can crop up, like your red blood cell count can get too high.
Yeah.
So there's some of those things clinically that we look at and we keep an eye on to make sure that we're fixing anything that may get out of shape.
Gotcha. Okay, cool. And so maybe that's a good way of showing that the importance of getting regular blood work done.
Absolutely.
If you're doing this. You can't just be putting hormones in your body and not checking the blood work to see. What it's
endocrinology is the study of the endocrine system, but it's very complex. We specialize in just testosterone, really. And it takes quite a while to get good at this. So yeah, just throwing hormones at your body is not a good idea to do that and not monitor it. Whether it's your thyroid or your testicles, it's not a good plan.
Right. So one thing you did mention earlier was about estrogen and trying to not only keep your testosterone in an appropriate level, but also keep your estrogen in an appropriate level.
Yep.
Maybe can you talk a little bit about how taking testosterone might increase your estrogen, and then how you guys help keep that in line?
Yeah. So men primarily make estrogen through a process called aromatization, and it's a protein called aromatase, but it depends on, again, the individual, because you and I probably don't have the same amount of aromatase, so we won't aromatize at the same rate. So what we do is with labs, we give injections, we see how do you respond, and then we have aromatase inhibitors, estrogen blockers, that we use to regulate where your estrogen should be. And then, there's some guys that need none, and there's some guys that need a lot. And it's, but getting the testosterone to estrogen ratio correct is really, that's the big deal. Yeah. And it's why when your testosterone drops to 200, if your estrogen's sitting at 40 or 50, why you cry at a Hallmark movie. You become estrogen dominant, even though it's not more. Yeah, it's more than it should be, and your ratio is really off. Yeah. Like I said, we like for our guys to be at 700 on their testosterone while their estrogen's at 30. That ratio really has guys in good shape, not having issues. Yeah.
To help people kind of understand and clarify, your body will take the testosterone and convert it into estrogen. Correct. As a male. And so what y'all do is y'all give them a drug that prevents that from happening. Correct. You don't want to eliminate it. What happens if you get your estrogen too low?
Oh yeah. Yeah. So if you get it too low, sex drive goes away completely. Empathy goes away almost completely. You just won't care at all about anything. Yeah. And it's not a place where really any of us want to be. No. But yeah, you lose interest in sex, you lose interest in hobbies, you just work, all of it. It just all goes away.
And what happens if your estrogen is too high?
If it's too high, usually performance in sex is affected greatly. Erectile dysfunction becomes fairly common. Yep. Your emotions can get out of control, where you're crying at a Hallmark movie, or a commercial that comes on that's got puppy dogs on it that you wouldn't usually cry at, all of a sudden you can't hold it in.
Yeah.
And so that's kind of a
Maybe
marker.
Maybe the desire to watch a Hallmark movie would be a first
That'd be
indicator.
a first indication.
And then
right?
if you cry,
then
that's a confirmation.
Now we know.
That's confirmation.
Like I had a patient who he was watching women's NCAA basketball, and it wasn't a team that he even cared about, but when they won, he found himself crying. And his son, who's an adult son, looks at him and says, "What's wrong with you?" And he said, "I don't know. I'm just so happy for them." And so he relayed that story to me, and I said, "Okay, let's get you fixed."
All right. Anecdotally, I think your estrogen's a little high.
high.
Let's just confirm that.
and it was confirmed through lab testing that he was indeed a little high on his estrogen, and we got that under control. He was back to good.
That is awesome.
Yeah.
Okay. Is there any potential risks involved with taking replacement testosterone over the long term? Because listen, so you're in your 30s, and the reality is, it's like, okay, if I'm in the 30s and I got to go on testosterone replacement, I'm on this for the rest of my life.
Right.
So
yeah, you're on it for possibly 40 to 50 more years. Yeah. So what we're seeing through the studies that have taken place is you decrease your risk for heart attack and stroke. You decrease it appears to decrease your risk for prostate cancer. There's not been a definitive study saying all of these things. There are studies that suggest them. But what we see, again, anecdotally, is if I'm active, if I'm engaged in healthy activities, I'm going to have less body fat and less prevalence for diabetes and for my blood pressure is not going to be as high as if I'm not active.
Right.
So we see that those healthy activities and being leaner, that's going to help out. And then prostate wise, having an active sex life helps your prostate to function at its best level. So it would make sense that if I'm doing all these activities and staying essentially young, that my body continues to operate well.
Yes, it may be not like a direct impact, but it's the side effects of the way testosterone makes you feel.
Yeah, of healthy living.
Yeah, it makes you live healthy, and obviously the healthier you live, the longer you're probably going to live.
Correct.
I was on Joe Rogan. He had Peter Attia, who's a sports scientist, and he was talking about how the positive impact on longevity of being fit was 5x the negative impact that smoking had on longevity. In other words, your life expectancy is increased 5 times more by being fit than it is decreased by smoking. So that's like how positive an impact exercise and living healthy have. So that's okay. What if I get on testosterone in my 70s?
Yeah. There is, we've got there's good research on that. The VA did a big study on guys in their, I think, 65 plus, and it shows similar effects that they're healthier. They're more active. Mental clarity, because this is one of those things that your cognitive abilities improve with testosterone. And so, there is still, concern with somebody who has active prostate cancer. Almost always the urologist will say, let's get you off of testosterone. There was a study in England a few years ago that they had guys, they could not fix their prostate cancer through the normal methods. And so they decided to try high-dose testosterone.
What's high dose?
Well, just running them, I think they're running them between 700 and 1,000 on their levels.
Okay.
And they eliminated their prostate cancer. So those sorts of things it's a smaller study. It's not definitive, but they are suggestive of there's something more to this.
It seems like it's suggestive that having healthy endocrine levels is key in like all health functions.
Yeah.
If they're too low, it's going to have a negative impact. If they're too high, it's going to have a negative impact. We got to keep them in this range, and that seems to like help your body perform the way it's designed to perform.
Right. Well, and it is. It's a key ingredient. So if we're talking about cars and you don't have enough oil in your engine, your engine's not going to run as long and it's not going to run as well.
Yeah.
And so, having all of the fluids topped off and everything, the tires are inflated correctly, everything's working well, the car runs good.
Yeah.
We're not cars, but when we have our levels where they're supposed to be and we're taking care of our bodies, they tend to run a lot better.
Yeah. I use a car analogy all the time.
Yeah.
How long has, all right, that's not including like 1940s Germany and like 1950s, 60s USSR, how long has like mainstream medical testosterone replacement been going on?
So there have been doctors doing it, I think, pretty regularly since the 70s.
Okay.
It has not been wide or mainstream. It hadn't been widely used. In 2007, our company, Ageless Men's Health, started up, and we were arguably the first clinic set up just for doing this.
Yeah.
And there are a lot that exist today in the marketplace. But 2007 really was a kind of a watershed of, we'll check your levels. You don't have to go through urology. You don't have to jump through all these hoops with endocrinology.
Yeah.
Come in. We'll see if you're low. If you're low, we're going to start you on treatment. If the treatment works, you keep on going. If it doesn't work, if there's side effects that are too much to manage, then you can come off treatment.
Yeah.
So this is, but it has been life-changing for a great number of people.
Yeah, and I think that's what I've seen in talking to guys is one of the importance of going to like a testosterone clinic a clinic that specializes in men's health and men's testosterone is like, that's what you do all day, every day. That's what you're focused on.
Yep.
And typically within that, you see even just kind of a more general, like holistic, healthy approach to health care versus sometimes going to an endocrinologist or your primary health care physician. They may not be geared towards that. And they're kind of like, you don't have anything wrong with you drastically. Why are we going to do anything?
So why would we fix you?
We're not going to fix,
and that's the medical system is largely set up to fix a problem.
Yeah.
And we are doing more preventive health.
Right.
One of the big advantages we have too is we do see most of our patients once a week.
Yeah.
So our guys and gals are seeing a nurse or a nurse practitioner once a week. With that, we get to know them. And so if we see a change, we can identify that change.
And you're getting regular blood work and vitals done.
Absolutely. Yeah.
Versus a lot of guys, like, I'm not going to go to the doctor until I feel bad.
Right.
And then you don't have any regular baseline.
Where's your baseline? Yep.
Anything to go from. So,
right.
We don't, is this high blood pressure? Shit,
No.
I don't know.
Right.
So,
right.
All right, dude. I don't have any more questions. Do you have any final kind of thoughts? And then also let us know like how people can get in touch with y'all, how they can find y'all, how they can go about getting their testosterone levels checked and fixed if they're too low.
Yeah. Well, first off, thank you for having me on. This has been fun. We are easy to find on the internet, agelessmenshealth.com. And then you can find our locations. We've got 54 locations across the country.
Dang, that's
we've
awesome.
got 5 in the Memphis area. So we're pretty easy to get to around here. We have a program set up right now. We're doing free screenings for blood work. You come in, we'll check your testosterone, your estrogen, see where you are. And if you're low, then we'll get you started on treatment. But it's we've got nurse practitioners at each of our locations. So there's somebody that is overseeing the health care of each patient at each location. But yeah, we're easy to find on the internet with agelessmenshealth.com.
Awesome. And so a lot of our listeners live here in Cordova or go to this gym in Cordova. What's the closest one to this location?
So we've got one in Wolf Chase.
Okay.
It's at 2257 North Germantown Parkway, and then we've got one in Germantown on Poplar. I think it's 9067 Poplar.
Very cool.
Forest Hill, Irene, and Poplar. But both of those are easy. And then we've got the Oak Court one is right there at the Oak Court Mall, so we've got some. It's not that far from here either.
Yeah.
And so it's lots of options.
And so, and can someone go to any location? So maybe on this day they're closer to that one, and this day they're closer to this one. Could they go to different locations? Because
So once they're in our system, they can bounce around, and we've got guys that do that.
Awesome.
That where if work takes them to a different area, or when they're at work they go to this clinic, but then if they're off and they're at home, they may come see me in South Haven.
Nice.
But yeah, it's once you're in the system, it's pretty easy to bounce around.
Very cool. All right, guys, y'all heard it. Go check out agelessmenshealth.com. Get your testosterone levels checked. Get them in the right levels so you can be a man again. It's awesome. All right, thanks, Jason.
Thank you, David.
MBS Fitness Radio out.
Thank you for listening to NBS Fitness Radio. If you enjoyed the podcast, be sure to share it with your friends, follow us on social media, and check out our website at www.nbsfitness.net. Hit the subscribe button and tune in next time for more NBS Fitness Radio.